Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Bauchi government partners to construct 350-bed capacity teaching hospital worth millions of dollars to improve healthcare in the state. Cross River government retrain teachers on COVID-19 handling as schools reopen. And France sees cases rise exponentially, and other European countries like Poland register record new infections as White House infections spread. Now, around the world, more than 35.9 million cases of COVID-19 have been confirmed globally, with more than 1 million deaths recorded. Figures on the African continent shows the virus is now at over 1.5 million cases, and more than 1.2 million have recovered, leaving 36,000 deaths cumulatively. In West Africa, Nigeria, the Nigeria Center for Disease Control reported 118 new cases from 14 states, and you would see that the total has summed up some of the figures that we have coming in from our Channels TV data dashboard. Confirmed cases at 59,583. Now, some of the cases from last night had Lagos seeing 41 cases, followed by Rivers recording 19 cases, Osun State as well recording 17 cases, and several of the other states. States like Niger, Plateau recorded 2 and 1 each. Also did Akwa Ibom State. Now, this has put our total numbers inching closer to 60,000 confirmed cases. But the good news is that we're also discharging a good number, and you can see that in green, the total number of recoveries at 51,308. Now, in terms of the active case, Lagos is managing over 50% of the active cases. Its cases presently are at 4,238, with other states like Plateau, the Federal Capital Territory, Rivers, Nasarawa, Gombe, Enugu, and I believe Ogun State, they're each managing at least over 100 cases as it is not right now. When you look at the cases in red, and sadly these are the cases that we've lost due to the virus, the death toll, it is cheering to note that we haven't recorded any death in 3 straight days. The last death was recorded October the 3rd. That was on Saturday, and that was recorded in Kaduna State. It's still important to note that all of the information coming out there, it's still level 3 in terms of the multi-sectoral National Emergency Operations Center that has been activated to essentially coordinate the national response to COVID-19. But the NCDC today has added the Niger State Public Health Laboratory, MINA, to the NCDC Molecular Laboratory Network. So far, in 8 months, there are at least 1 laboratory for COVID-19 testing in all 36 states, plus the Federal Capital Territory. So let's find out some more about how indeed we are flattening the curve in Nigeria. Joining us right now is Dr. Yunusa Tahiru. He's the Associate Professor, Consultant Immunovirologist, Team Lead, University of Abuja Teaching Hospital Isolation Center, Gwagwalada. He joins us from Abuja. Thank you for joining us on the program. All right, Dr. Tahiru, all right, thank you so much. Let me begin with the first question, and this is talking about the death toll, yes. Can there be differences in how and when a COVID-19 death is reported?
COVID-19 death, there is a coordinated way in which we have reporting these deaths of COVID-19. Most instances you find when a patient actually, dies, there is a protocol by which you have to follow to have this being reported. this is based on the action plan by the stakeholders to make sure that this actually is recorded. When a patient dies from a treatment center, 3 activation takes place. The head of the center is informed, and you have the public health department also being informed because they coordinate that part in the state. And then we also have that activation of those individuals that are going to help to follow the guidelines for burial. Let me just remind you that based on the NCDC protocol, we have that we have the limited number of people that should be within the burial ground where these corpses are going to be disposed. And also the movement of these corpses from the evacuation of these corpses from the treatment center to the graveyard has to be seamless with IPC, infection prevention protocol, being taken into consideration. And that simply means that you have to put these dead bodies inside a body bag with 0.5% hypochlorite, all in it, and then to take it there. All what we are trying to do in SS is to prevent infection and also to protect other people, sympathizers and other people that are going to be involved in the burial. So it has to be, it's well coordinated, and I think this is something that we have to give it to our people because it has to be coordinated such that nobody gets infected as a result of a death from COVID-19. Once this is now reported, the state PID will now take it to the state level, from the state level then to the federal level, and this is the outcome whereby when you now see that they will now say this is also certain number of dead rate in the country.
Okay, Dr. Tahiru, a number of times
we hear that you have already said
if
that
I may,
for 3 consecutive days.
Yes. I'm probably going to get your point on that. What you think? We've recorded 3 straight days, no deaths. If you think that is great news, I mean, it is good news. But then, what you think is responsible for that? But I also want to get your thoughts on how comorbidities are reflected on death certificate.
Yeah. Frankly speaking, this is good news, and I'm quite happy that we've not been recording deaths and that simply will tell us that we are doing very well with my fantastic co-workers all over the treatment centers in Nigeria, meaning we are doing very well and patients are being managed. That does not actually take out the fact that now we are getting a more better understanding of COVID-19, SARS-CoV-2, and its problem as it comes with, most especially with patients with comorbidity. Minister, you know that most of the deaths that have been recorded over those recent early periods are always said to be attributed to a patient coming in with comorbidities, and that is usually affects the management of the patient. But now, I think we've actually got to know more about it, and comorbidities actually do affect, and we do manage the comorbidities alongside managing the patient for COVID and giving the patient a psychological effect. And as per recording in the death certificate, yes, the protocol that is involved in writing a death certificate simply means you need to have the name of the individual, you need to know the time of death, you need to know the hour of death, how many hours the patient have stayed in the treatment center. And in that column also, we now come in to say what the patient actually came with, presenting signs and symptoms, followed up with what? With the comorbidities the patient comes with. So either can be hypertension, can be diabetics, and all those forms. But we know usually in various treatment centers in the FCT, for which I can speak for, most of the comorbidities are as a result of diabetes mellitus when patient comes in, and they complicate the management of those patients. But good sharing that we do not have any death. So that is actually recorded on the death sentence, Millicent.
All right. We would like to thank you, Dr. Unisa Tahiru, Associate Professor, Consultant Immunovirologist, Team Lead, UATH. Abuja, thank you for joining us on the program.
On the death certificate, sorry. Yeah.
That's all right. Thank you so much. Glad to have you on the program. Now let's go to Cross River State, where the government has organised a 2-day training for teachers, head teachers and principals of all public schools on the coronavirus prevention protocols ahead of school resumption. While addressing the stakeholders in Calabar, the Commissioner for Health, who also doubles as the COVID-19 Task Force Chairman, says the training is necessary and aims to create a link between the COVID-19 Task Force team and the public schools, both at the state and local government level, for quick response in case of suspected cases.
What we are doing is to hold training for our teachers, head teachers and principals of all public schools in Cross River State. We've done an engagement for the private schools, and presently we are engaging to train those who are in the public schools in Cross River State. We're teaching them the infection prevention and control protocol. We're teaching them what the expectations will be as they go back into the schools to teach our children. We want to be sure that we link the team in the school with the rapid response team at the state level and at the local government level. So if they have suspected cases of COVID-19, they know who to immediately call for help. We're also teaching them the protocol which they must observe every single day and what they're expected to do as our kids go back to school. It's important that they continue to ensure that all the basic safety measures are put in place, including running water for our children to wash their hands as often as possible, including face masks for every child that's going back to school, hand sanitizers, disinfectant machines, disinfecting toenails, as well as other temperature check machines, digital machines that can help them continue to keep track of every child that's within their premises.
The Lagos State government has set up a holding area with a 20-person capacity within the premises of the state's teaching hospital, LASUTH, to keep suspected COVID-19 patients for a period of time. According to the Chief Medical Director of LASUTH, the facility will help ensure patients infected with the virus are separated from other patients. Here's more. Our correspondent, Titilayo Aberowo.
Normal activities are gradually returning to Lagos State, but with conscious effort at staying within the COVID-19 safety protocols. Even though Lagos is already experiencing what the incident commanders call a decline in COVID-19 numbers, the government is still setting up facilities. The latest being this holding bay and eye care unit at the Lagos State University Teaching Hospital. This is one of the 20 rooms where suspected patients of COVID-19 will be isolated for a while, until their health status is determined by the doctors and eventually transferred to the appropriate quarters. One of the doctors explained the need for the facility.
We run 24 hours shift here. So we have 2 doctors per shift. We have 4 nurses per shift. We have 4 other health workers, supportive health workers. Patients will come in through the emergencies. If we have suspicious cases, they inform us, we go to review with them. So we admit in the long run, and then we start our process.
The pandemic is clearly an eye-opener to the importance of being ready for emergencies. Senior officials here insist the deadly virus is still with us.
During the peak of the pandemic, because we are still in the pandemic, during the peak, a lot of patients who were COVID suspects had nowhere to be accommodated. So we thought of this concept of a holding bay where you can keep COVID suspects pending the outcome of their results. And so that's what we have here.
COVID can be divided into 2 types, the bread and butter COVID and the complicated COVID. And right earlier on, we had a number of conversations between myself and the CMD and the board to say what should be the role of a tertiary academic institution in the combat or the battle against COVID. And my advice was that LASUTH shouldn't get involved in day-to-day ordinary COVID management, but that LASUTH, as its status reflects, should be dealing with complicated cases that we cannot manage in any of the standard isolation centers.
The wife of the state governor, who is also a medical doctor, says this is the time to do more for the health sector.
It is important to emphasize that now is not the time for us to rest on our oars. Rather, it is a time to remain conscious of the pandemic and to continue to intensify efforts of flattening the curve.
The Holding Bay is a purpose-built self-contained 20-bed facility with a provision for 4 intensive care units with high-tech medical equipment and personnel that will provide specialized eye care services. Titilayo Aberewo, Channels Television News.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. The Bauchi State Government has signed a memorandum of understanding with a UK-based investment company, HP Capital, for expansion of the teaching hospital, construction of more bed capacity worth millions of dollars. Investors explain that the facility is a self-sustainable hospital and is expected to provide employment to about 4,000 staff. Governor Bala Mohammed expressed excitement about the project and the outlook for the health sector in the state, especially under the coronavirus pandemic.
We intend to make sure we market this business with pride and with all our energies so that your investment would be recouped on Bauchi. We pledge to give you the security of your investment and the viability of the project. And of course, within the colleagues of mine, the governors in the Northeast and in Nigeria, definitely they will find this kind of investment very timely and useful. We thank you most sincerely for having confidence in Nigeria, in Africa, in Bauchi. And of course, we know what it takes to make sure we sustain this investment or this MOU. Whatever we pledge to provide in the terms of the MOU, I pledge as a leader of Bauchi will do that. We know the importance of investment within the realm of $500 million. That will give us a lot of leverage to reduce the capital plight as well as build human capital for health that we are doing the health summit recently.
The coronavirus pandemic has hugely affected the Nasarawa state economy with billions of naira outstanding in the land sector. According to the government, to cushion the effects on its citizens and enable the economy recover, the government is reducing land charges by 20 and 25%. The decision, according to the Director General of the Nasarawa State Geographic Information System, Mr. Sonny Agassi, is ratified by the State Executive Council and billed to run from October to December.
Any bill from 1 naira to 150 million naira, there's a 20% cut. That essentially means if you have a bill of 100,000, as at October 1st, your bill is now 80,000. And if you have a bill from 150 and above, your bill will be cut by 25%. So there's a window of just 3 months for all citizens and applicants to take advantage of it. And we're encouraging applicants as such to take advantage of this opportunity. And we did this deliberately to ensure that citizens feel the cushion of the hard times that we're going through in the country, particularly with respect to the COVID-19 and its effect on all of us.
Now to the global scene. In Paris, COVID-19 patients are taking up more than 40% of intensive care beds. This is as other European countries, such as Poland, register record new infections. In the U.S., Democrat Joe Biden says the next presidential debate on the 15th of October should not take place if the president still has COVID-19. Well, here's more on the COVID-19 global update.
The situation in Scotland has led First Minister Nicola Sturgeon to announce at a press briefing that pubs, bars, restaurants and cafes across central Scotland, including Glasgow and Edinburgh, will be forced to close for 2 weeks from Friday, including other restrictions for hotels, cafes, game halls, gyms and contact sports. She also warned people to avoid public transport in central Scotland. Scotland has been recording 730 new coronavirus cases daily on the average, compared with 285 a fortnight ago. Over in France, doctors are worried over the rise in the number of critical beds dedicated to COVID-19 patients. The number of cases in the country has risen to 634,763, with 10,489 new cases over the past 24 hours as of Tuesday. The capital, Paris, and its surrounding suburbs have been put on maximum alert, with new restrictions aimed at stopping the spread of the virus to be implemented for 15 days starting yesterday. The Belgian capital, Brussels, is warming up for new restrictions. From tomorrow morning, all cafes and bars and its surrounding region are being instructed to shut down for a month. Drinking alcohol outdoors will also be banned. The government says Brussels is now in the top 3 most infected cities in Europe, still below Madrid, but above Paris, where a similar rule for bars has already been introduced.
Now, here's a programming note for you. All is now set for the governorship debate between some of the candidates taking part in the Ondo governorship election billed for Saturday, October 10. The debate is organized by Channels Television in partnership with the Civil Society Election Situation Room, UK Aid, with support from UK Foreign Commonwealth Development Office. 3 candidates were selected through a scientific process by our partners, and they will take the stage tonight in an encounter that hopes to unearth the plans of the candidates and how they hope to achieve them. The candidates are the incumbent governor and candidate of the All Progressives Congress, Oluwarotimi Akeredolu, candidate of the People's Democratic Party, Eyitayo Jegede, and the current deputy governor and candidate of Zenith Labour Party, Agbola Ajayi. The debate will start in about 30 minutes at 7 p.m. sharp. You can catch it right here on Channels Television and also on all our social media platforms. The hashtag to track the event is Ondo Debate 2020. Hashtag Ondo Debate 2020. Remember that wearing a face mask incorrectly is as good as not wearing a mask at all. Continue to take responsibility. Visit our website. It's channelstv.com. You find more information, more updates, more on the debate, several other stories as well on the pandemic at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.